Hello everyone, welcome to NG's Corner for Nurses. Hope all of you are doing well. So today we are here with the last session of urinary system. In this part, we will discuss the anatomy of urethra. If you want to review the last 4 sessions, you can go through the link which is given in the description box. This is the outline of today's session. The urethra is a small tube leading from the internal urethral orifice in the floor of urinary bladder to the exterior of the body. Let's start with female urethra. In females, the urethra lies directly posterior to the pubic symphysis. It is directed obliquely inferiorly and anteriorly and has a length of 4 cm. It crosses the perineal membrane and ends at external urethral orifice. The external urethral orifice is located between the clitoris and vaginal opening. The wall of the female urethra consists of a deep mucosa and a superficial muscularis. The mucosa is a mucous membrane composed of epithelium and lamina propria. The muscularis consists of circularly arranged smooth muscle fibers. Near the urinary bladder, the mucosa contains transitional epithelium. Near the external urethral orifice, the epithelium is non-keratinized, stratified squamous epithelium. And between these areas, the mucosa contains stratified or pseudostratified columnar epithelium. Next, coming to the glands around the female urethra. First is paraurethral glands or Skin's gland. Two small ducts either side of the urethra. This correspond with the prostate gland of male and their ducts open close to the external urethral orifice. Next one is greater vestibular glands, that is the Bartholin's gland. These are the compound racemose glands. Racemose means made up of numerous small clustered sacs similar to the structure of a bunch of grapes. And these are situated behind the bulb of the vestibule in the superficial perineal pouch. And these both glands secrete mucus and lubricate the vagina during sexual arousal. Next, the blood supply. The arteries involved in the blood supply, that are supravesicular artery and vaginal artery. And the veins include the venous plexus around urethra to vesical venous plexus to internal pudendal veins and finally to the internal iliac vein. And the lymphatic drainage through internal and external iliac lymph nodes. Next, coming to the nerve supply, the parasympathetic preganglionic fibers from sacral second to sacral fourth segment of spinal cord, and these run through pelvic splenic nerve and synapse in vesical venous plexus. And postganglionic fibers reach smooth muscle. Somatic fibers from second sacral to fourth sacral segments reach the striated muscle through pelvic splenic nerve that do not synapse in vesical plexus. And the sensory fibers in pelvic splenic nerves reach to second sacral to fourth sacral segments of spinal cord, and postganglionic sympathetic fibers arise from plexus around the vaginal arteries. Next, coming to the male urethra. In males, urethra first passes through the prostate, then through the deep muscles of the perineum and finally through the penis, a distance of about 20 cm. So, the male urethra can be divided into posterior urethra and anterior urethra. And the posterior urethra is further divided into pre-prostatic urethra, prostatic urethra and membranous urethra. And the anterior urethra is further divided into bulbous urethra and penile urethra. Let's start with posterior urethra. First is pre-prostatic part. The length is about 1 to 1.5 centimeter. It extends almost vertically from bladder neck to verumontanum. That is the superior aspect in prostatic urethra. And this part is surrounded by proximal urethral sphincter mechanism. Contraction of pre-prostatic urethra serves to prevent retrograde flow of ejaculate through proximal urethra into bladder. Next is prostatic part. The length is about 3 to 4 centimeter. Formed at the bladder neck, turns anteriorly 35 degrees and exits the prostate at the apex. Throughout its length, the posterior wall has a midline ridge called urethral crest. On each side of crest are shallow depressions called prostatic sinus, the floor of which is perforated by orifices of 15 to 20 prostatic ducts. There is an elevation called verumontanum at the middle of the urethral crest, and it contains the slit-like orifice of prostatic utricle, and both sides of or just within this orifice are the two small openings of the ejaculatory ducts. Next is the membranous part. Length is about 2 to 2.5 centimeter. It extends from the proximal bulbar urethra to the distal verumontanum, and it is surrounded by the thin layers of bundles of smooth muscle with striated muscle fibers called the rhabdosphincter, which forms external urethral sphincter. Next, coming to the anterior urethra, first is bulbar urethra. The part of anterior urethra which is surrounded by bulbospongiosus is called bulbar urethra, and it is the white part of urethra, and bulbourethral glands open in this section 2.5 centimeter below the perineal membrane. Next part is the penile urethra. When penis is flaccid, urethra curves downwards as penile urethra. It is narrow, a slit-like when empty, and has diameter of 6 millimeter when passing urine. It is dilated at its termination within the glans penis, and dilatation is called navicular fossa. External urethral orifice is the narrowest part of urethra and is a sagittal slit, 6 millimeter long, bounded on each side by a small labium. The male urethra, which is consists of a deep mucosa and a superficial muscularis. The epithelium of the prostatic urethra is consists of transitional epithelium that becomes stratified columnar or pseudo-stratified columnar epithelium more distally. The mucosa of the membranous urethra contains stratified columnar or pseudo-stratified columnar epithelium. The epithelium of the spongy urethra means penile urethra, is stratified columnar or pseudo-stratified columnar epithelium except near the external urethral orifice. There it is non-keratinized stratified squamous epithelium. The lamina propria of the male urethra is areolar connective tissue with elastic fibers and a plexus of veins. The muscularis of prostatic urethra is composed of mostly circular smooth muscle fibers superficial to the lamina propria, And this circular fibers helps to form the internal urethral sphincter. And the muscularies of the membranous urethra consists of circularly arranged skeletal muscle fibers of the deep muscles of perineum that help to form the external urethral sphincter. Next, coming to the blood supply, the arteries involved are urethral artery arises from internal pudendal artery and dorsal penile artery. And the veins for anterior urethra, the dorsal vein of penis to the internal pudendal vein, and finally to the internal iliac veins. And for posterior urethra, the prostatic and vesical venous plexus to the internal iliac veins. The lymphatic drainage includes the prostatic and membranous part drain into the internal iliac lymph nodes. Membranous part drains into internal iliac lymph nodes, and the spongy part drains into the deep inguinal lymph nodes. Next, coming to the nerve supply, most of the urethra is supplied by autonomic nerves and terminal part by somatic nerves. Sympathetic fibers are derived from the superior hypogastric plexus, and the preganglionic fibers comes from lumbar 1 and lumbar 2 segments. And parasympathetic fibers are derived from pelvic splenic nerves carrying preganglionic fibers from second sacral, third sacral and fourth sacral segments. And the somatic fibers are derived from the urethral branch of the pudendal nerves. If this content is useful for you, then please put a like and share it with others. And for getting more videos like this, you can subscribe my YouTube channel NG's Corner for Nurses. And for any queries or for any suggestions, you are most welcome to comment. Thank you for listening.